Trying to prevent you from getting the benefits you earned. New policy by the Social Security Administration, first time since 1935. They're restricting access to your benefits, the benefits you paid FICA taxes for all those decades. So I'm going to talk about that today and what we can do about it to fight back. All right. So if you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. So I know how difficult it is to work in Social Security. I know how difficult it is to navigate Social Security from the other side. It's got 20,000 pages of policy. There's exceptions, the exceptions, the exceptions, and you really do need help to navigate their bureaucracy. There's a lot of people out on social media that think they know Social Security, but unfortunately, unless you've taken a few 100,000 retirement claims and survivor claims and disability claims, most of the information I see out there is kind of partial, incorrect, clickbaity, if you would, I guess. So, all right. So this is also a way for politicians. So they're limiting access. So starting, the Social Security Administration has already started to limit access to your Social Security benefits by limiting access to the Social Security office. You have to have an appointment, and so they're rolling this out in a couple of phases. One phase has already started. The other phase is going to go full into effect on January 6th. And so, in order to get your benefits, it's a reservation only system. Could you imagine that? Try this. Call the most expensive restaurant in your town, most expensive restaurant, and try to get a reservation, right? And then call the Social Security Administration and try to get a reservation to help you get your benefits. I'm almost guarantee that you'll get a reservation at the top 5 class restaurant in your town sooner than you're going to be able to get a reservations to talk to someone at Social Security Administration. So this new system about reservation only, again, this is the first time it's happened since 1935. And why is it happening? Simply because the politicians refuse to fund Social Security, refuse to have Social Security get the staff they need now to help you get your benefits, to navigate their bureaucracy, to help you strategize, and all the rest of it. So it's important that Social Security, it's the 50-year low in terms of staffing. So they're at the worst staffing level in 50 years. And this is a conscious decision by politicians to cut the budget. The Social Security budget is only it's about 1% right now, but it should be about 1.2% of what's paid every year. So about $1 trillion is paid from out of Social Security, retirement, funds and everything like that, Social Security, disability, survivor benefits, spouse benefits, and the overhead for all the offices in the country and all the staff and the electricity and the rent and the computer systems is about 1.2% of that. So imagine any other company having that type of low overhead. Check out JP Morgan or Allstate or whatever insurance company. I doubt they have a 1.2% overhead, but Social Security, that's all they need is 1.2%. Right now we're looking at about 1%. They just need that extra 0.2% to hire staff. And unfortunately, if I put a petition in there, so please make sure you sign the petition. I'll put it in the description as well. Sign the petition, and we need to send that to Congress and tell them to fund it so y'all have access to your benefits. And the unfortunate part is, if we get this done and the Social Security offices are staffed again and they can help you, and I can go back into retirement, so I don't have to make these videos and do these live Q&As to help you get your benefits, then it's going to take about a year or two to make a difference, because in order to get someone hired off the street and get them trained, that's 40 hours a week, and it takes about a good year or two to teach them how to adjudicate all the claims and read through the 20,000 pages of policy and all the rest of it. That's why I hate these social media people out there. That there's a company out there, a educational institution that provides a 2-day training on all things Social Security and Medicare. And then once you take that online training, you pay them a few $1,000s. You get this cute little certificate that says, I am a Social Security expert. And they go out there and cause trouble and give out wrong information. It's terrible. Anyway, but even if Social Security got the money to hire the people that they need in offices in your local office, then it's going to take about a year or two to make a difference. Actually, the customer service will get worse for a while because there's people in those offices that have to train and supervise OJT, on the job training of those new people that are coming in. So, unfortunately, we have to do this now. We have to do it immediately. And another way to get this done is to sign the petition. Also, contact your local Congress people, your senators, your House of Representatives, and say, okay, you refuse to save Social Security and the cuts that are coming in the future, 2034, 2031. But what are you doing? You refuse to save Social Security nationally, but what are you doing at your local office? Why is it that I call the local office right down the street from your office, congressperson, whoever, and it takes me 3 hours to get on the to get somebody, and then they hang up or they give me the wrong information. I can't make an appointment for a month or two. Why is it? Why are you not supporting your local office right down the street from you? So if everybody did that in the country, then customer service hopefully would get a bit better. But right now, it is a conscious decision to, and particularly the vulnerable, because the politicians, they don't need the two or three, $4,000 they're getting from Social Security, and they can cut the line. The rest of us have to wait. But if they want to go ahead and file for benefits, or someone in their office want to go ahead and file for retirement, they cut the line, obviously. But they don't care. Most politicians don't care about the $2,000 or $3,000 a month they get from Social Security, because you know they've got more than enough, so they don't need to worry about how long it takes. It's the other people, it's the vulnerable people, it's the aged, it's the disabled, it's the people low income that can't get a bus and can't wait for 2 months to find out what's going on with their check. So we need to address this. And another way, speaking from the inside, Social Security offices, they have kind of a whack-a-mole situation. So anytime there's something nationally about, hey, the lines are too long, people are, in my office, the line, wrapped around the building. And then it would come down and they would say, hey, you need to work your line better. Oh, okay, well, we'll put more staff on the line outside. But that sacrifices picking up the phones. And then, okay, well, you need to work on the line and the phones. Okay, we can do that. Well, that sacrifice is actually adjudicating the claims. So we take a whole bunch of people in and we take their claims and stuff, but we can't adjudicate them because we're just taking more intake. So then need more appointments. Okay, more appointments than the line. It's one of those whack-a-mole situations. So we got those three or four things that the Social Security offices, because they're so understaffed, the technology is so is so backwards. Yes, there should be a little bit more efficiency, but that's only going to a few percent here and there. They just need bodies. That's pretty much it. They need trained bodies to provide information so you can talk to a human being to make sure you're getting all the benefits you're entitled to. Okay, there is my and remember, you paid for this. When you paid your FICA all of those decades, the 6.2%, and your employer paid the 6.2% for Social Security, the FICA tax. Part of that was supposed to go for help. So you paid for that since you're, in your teens and 20s. And part of that money was supposed to, okay, when I file for retirement, or my spouse files for survivor benefits or spouse benefits or disability or whatever the case may be, not only will that money be there, you're going to help me navigate the bureaucracy and make sure I'm getting everything I'm entitled to. But now politicians are essentially killing that commitment they had to help you, for their own purposes, as a way to kind of destroy Social Security through 1,000 cuts. We're going to see the cuts coming. That I've got the link in the description below about the future cuts. Either in 2034, we're looking at about 21% across the board of cuts of Social Security checks, everybody's Social Security checks. If nothing is done right now, we're looking at about 21% cuts. If the next president does some of the things he's talking about, then we're looking at a few years earlier, and there's going to be a 33% cut, not in the next presidential term, but the one after. But if we do something, if we get this done, then we can avoid those cuts, and we'll have 0% cuts, and Social Security will be around here for us and our grandkids and all the rest of it. But those are future cuts. we also need to focus on the cuts that are happening right now. All the people that are not getting the benefits they're entitled to because they can't get access, they're getting the wrong information, they just give up, they're falling through the cracks, and there's so many people that are not getting benefits they're entitled to, they earned, because they just can't access the system. Okay, let's go ahead and move over into your questions. So if you have any questions on all things Social Security, retirement, disability, make sure you type them in. Top shelf, Social Security account online when time to apply for benefits. Do I have to provide original birth certificate? Yeah, if you file online, yeah, they're pushing a lot of stuff online, which is, it's convenient and stuff. But when you do it online, a human being still has to look at that. They still have to evaluate it and stuff. So it still takes man hours, human woman hours, people hours, labor to adjudicate that claim, to take a look at it. A few years ago, they streamlined the service. Sometimes you need a birth certificate, sometimes you don't. If you were born in the United States and everything is correct on your original Social Security card, the Social Security, your date of birth, your name, all that kind of stuff, then they can accept that as, because they're looking at proof of age. So they, want to make sure you are 62 or 67 or whatever the case may be. So most people that are born in the United States, if everything is correct, you don't need to provide a birth certificate. If you're born outside the United States, or if there's a discrepancy or something, then you might need a birth certificate. But most people nowadays don't. So, is passport good enough documentation if I have online Social Security account? Again, yeah, it's you. If you're born in the United States, you probably won't even need a birth certificate. So. I'm 69, divorced, and collecting Social Security. Was married more than 10 years and divorced more than 2 years. My ex husband's Social Security benefits are greater than mine. Can I apply for IEDS to get larger benefit? Yes, it definitely sounds like it. You've been divorced for 2 years. The independently entitled divorce benefits, number one, great on you that you know that. A lot of people don't know those benefits there. Independently entitled divorce benefits is when you file for divorce spouse benefits on a prior spouse, but they haven't started receiving benefits yet. And that's fine. They don't need to start benefits as long as they're 62. So if your ex is 62 years old and his is twice your benefit amount, again, your full benefit amount, not your check amount, your PIA, the primary insurance amount, which is the amount at your full retirement age. If that's less than half of his full benefit amount, absolutely, absolutely. Can you speak about SSDI in California if there's going to be cuts? Yeah, SSDI is a national program, Social Security Disability, and yeah, it's a national program. The DDSs, the Disability Determination Services, the places that make the medical determinations are state agencies, but they're funded by the federal government. Those offices throughout the country are, struggling just like Social Security offices. That's why it's taking 6 to 9 months. So this is another reason, people that are, you know, if you're disabled, unable to work. When I took the hundreds of thousands of disability claims I took when I was working at Social Security Administration, I used to tell everybody, used to tell us, says, okay, you should get a decision within 3 to 6 months. Now they're saying 6 to 9 months if you're lucky. Again, that's an attempt. That is a conscious decision by politicians to prevent you from getting your benefits by not getting people there. Just like, local Starbucks. If you walk into a Starbucks and there's only one person there making, busy Starbucks, then guess what? You're going to sit there and wait forever. It's just, we still need human beings. AI and technology and efficiency and all that. Yeah, it's all good and everything. And that's one of the distractions politicians use is they say, well, yeah, I would give Social Security more money, but I knew this one guy that had a sister down the street who had a brother who had a friend that got disability and they shouldn't have. Maybe you should evaluate that. And once you evaluate that, I'll give you. So these are it's a strategy they've been working on for decades to ignore the problems, to ignore the solutions, distract by saying the trust fund is stolen. It's not stolen. All the money is given to illegals. That the Social Security, retirement, disability benefits are not given to illegals. Fraud, waste, and abuse. Yes, there is a little fraud, waste, and abuse, but it's if they shut it all down, it's not going to make up the the billions of dollars that is needed. There's an internet myth of the day that always pops up about a distraction. Look over here, don't focus on the important part. And all of this is an intent to eventually privatize Social Security. Just like Medicare Advantage is privatized Medicare. And we see what's happening in the news with that one. And so there is an attempt to essentially privatize Social Security. So Social Security Advantage. So if you all want that, then don't sign the petition. Don't call your office. Don't demand that you get what you pay for. All right. Will my pension funds be used towards my 23,000 annual income, and is the monies I make for the year be calculated after 23? No, that your pension does not count for the annual earnings limit. No, it's only earned income. W-2 wages and net income from business and stuff like that. So no, you're good. U.S. Senate needs to pass the WEP. I completely disagree. WEP is the windfall elimination provision. There's about 3% of the population out there that did not pay into Social Security, and they want extra above and beyond what other people in a similar situation would get. They want an extra benefit, and I don't agree they should get an extra benefit. So there's my 2 cents. I've talked about this several times, and people just don't understand. They think their benefits are being cut. No, they're not getting cut. You're just not getting the extra benefit that was intended for low income wage earners. So watch my videos on that. How do I get added to the master beneficiary list from my ex-husband? Don't I need to show marriage divorce papers? Can't get an appointment on phone. See, right there. Politicians are trying to keep you from your benefits. So yeah, an MBR basically is yeah, the master beneficiary record is just that person's record, their PIA and their address and all that kind of stuff. So yeah, you have to file for benefits on that person's record, and if you're entitled, then you're added on there. As soon as you get a dollar from that person, you're on their MBR. Are more Social Security positions now going to be handled by AI? I certainly hope not. Social Security has been using kind of an AI type thing. They've got an algorithm they've been using for a long time to help with adjudication of claims and the development of disability claims in particular. It's one of the internet myths out there is that everybody's denied for disability the first time, and please stop repeating that. I'm sure it's a fun internet conspiracy myth, and you like anyway. You like being a contrarian or whatever the case may be, but you're doing a disservice because people hear that, and these people are really disabled and they're not able to work and they can't, make a living. Because, they can't pay their bills and stuff, and they're already kind of, they got their disability, and they hear this and they just give up and they say, well, if everybody's died, I just can't, deal with the rejection again, and they don't file because you keep repeating it. Please stop. Just please stop. I've taken hundreds of thousands of disability claims, and some of those, people come in tragic, car accidents, stage 4 cancer, whatever the case may be. They're approved the same exact day. I push the button, and by the time I leave the office, their claim has been adjudicated and approved. The next morning, same type of thing. A bunch of people that have been approved the next day. Some claims are approved that I don't think they should be approved, but I'm not a medical doctor, and some are denied that I'm like, wow, that should have never been denied. So go to the appeals process. So yeah, Social Security has been using kind of an algorithm for a while to help out with that. So is it perfect? No. And that's another way the politicians, kind of distract. They, perfect. They look for a perfect solution, and the perfect is the enemy of the good. They say, well, yeah, we could do this thing but that's not going to solve 100% of Social Security's problems, and Ed's not going to get his hair back. So if it's not perfect, then we shouldn't do it. So, we should do was it Toyota, the Kaizen, the continual improvement, improve a little bit every day. But yeah, there's people out there distract and say, well, if it's not a perfect solution, then hey, we shouldn't just do it at all. But anyway, does this defunding affect just new applications, or do they play to cut people already receiving benefits? Yeah, thanks for the question. It's not only access to get new benefits, to new retirement, spouse benefits, and all that other kind of stuff, but because Social Security staffing is so low, mistakes are going to be made even if you're receiving benefits. So if something happens and your employer puts in wrong, someone is using your Social Security number and putting in wages, and you get this overpayment, and you have to go down there and deal with the overpayment, but it takes you and you know The check might stop because you might have this overpayment, or 10% is withheld because you have an overpayment. It takes you a month or 2 months to figure it out, and by that time, your Medicare has stopped because you're not receiving benefits anymore. So, and then if something happens to you, you need to go file for disability, or something happens to you and your spouse has to go file for surviving spouse benefits. It's, just don't think of it as, well, I've already got my check, so I don't care. No, you need to think, please think about those around you and think about situations that could happen to you in the future. All right, top shelf, signed a petition. Thank you. Thank you. Um, Please help me understand, if an overpayment at 62 due to income exceeding requirement goes unpaid, how's that at impact benefits at 70? Would it be more beneficial to repay the overpayment? Yes, you have to pay the overpayment. If you don't repay it, you're going to have that overpayment, and eventually they're going to start. They do. They changed that policy a while ago, and this is a perfect example. Anderson Cooper did an expose on 60 Minutes about overpayments. And within a few months, the overpayment policy, a lot of it was changed. So it's a beautiful thing. So this we can do things. So it used to be, if you didn't respond, they withheld 100% of your check for an overpayment. But you know, just to kind of elicit you to to call Social Security so you can address the overpayment. Now they don't do that. They withhold 10%. So it's kind of, why do they do that? It's, if you get a if Social Security sends you an overpayment letter and you don't respond, they're like, okay, well, maybe this person is deceased, they're living overseas, they, whatever the case may be, so they stop your check. But that was, people didn't couldn't pay the rent, and now you can't get an appointment for 2 months, so it becomes a nightmare. So they say, okay, that's not a good thing. That's kind of drastic. So they say, but we really need this person to contact us. So now they just withhold 10% until you contact them. So if you don't contact them, they're going to withhold 10%. So if you set up a payment plan, they change the regulations to where it's easy to set up a payment plan of 60 months, and it's interest free. So 5 years payment plan, they can take a little bit out of your check every month, for 5 years. And it used to be, um, that you could do a payment plan for 12 months, super easy. 24 months just took another person to sign off on it in the office. Anything after that, you had to provide a SSA 632 and go through all the documents and provide financial why you can't do all this. So if you have an overpayment that's, you can't even do in 5 months, in 5 years, then you have to provide kind of financials of why you can't pay it back within that time frame. But yes, you definitely should take care of that overpayment. Absolutely. Our elected officials need to serve the constituents. We are so underserved and overlooked. Yes, exactly. But the cynical part of me, I guess their constituents are the billionaires, and that who fund their campaigns and stuff. So they really don't care about the rest of us Joe schmoes out here. Yeah. So until we voice our opinion, right? What exactly is being cut and for whom? I'm going to apply for benefits in January. My full retirement age is 67, so I'll be slightly early. Yeah. Again, as I talked about, access, you got your appointment, but the appointment system, you're like, oh, I like the appointment system. That's great. But actually, because they're doing these appointments, this is going to make customer service even worse. And you're like, how could it make it worse? They're setting up appointments. Well, because I ran the third business Social Security office in the country, and we used to get tapped all the time, because we were such kind of progressive, and we always, kind of the tip of the spear. We were always trying to, new things to make our office more efficient. So regional and national used to come down and say, "Hey, Ed, this guy's an idiot. He'll try anything." It's like a Mikey. He eats anything. So I used to come down and say, "Hey, why don't you try this?" And we try it, and sometimes it works, and sometimes it didn't. Some of the things that we did and are being done by all the offices in the country. But in terms of appointments, so the problem is, if you have an employee that has let's say a 2 o'clock appointment, and they have a 1:30 appointment. So they have a 1:30 appointment, and then the next appointment is at 2 o'clock. Well, if the 1:30 is a no-show, or if the 1:30 only takes 15, let's say the 1:30 only takes 15 minutes, you've got 15 minutes there that you're just kind of dead space, right? To call the next person. And so maybe you have some people in the lobby, and the people in the lobby, you're like, well, maybe I call that person, but that's probably going to take more than 15 minutes. So Yeah, it becomes a lot of downtime when you set up those blocks of appointments, and it just, I don't want to get too much in the weeds, but it's not a good system, and it's going to hurt even more going forward. Um, but so for you, if you get your access and you get the right benefit and you're told the right information, then you're beautiful. But then the next cuts, if nothing happens, then the next cuts happen as I popped up on the screen. 2034, 21% cuts if nothing is done. If the next president gets some of the policies passed, we're looking at 33% cuts. So that's what's going to happen in the future, even with you. And unless we do something, we've known about these cuts, these impending cuts for decades, and it's not the next president I'm blaming. It's this president and the previous president, which is President Trump again, and it was Clinton, and it was Obama, and it was Bush, and it was Daddy Bush, and it's all of their fault. So I'm singling anybody out. What is the petition name? Yeah, it's just a support Social Security offices. I'll put it in the description. I think I put it in the description as well. Do we have to go into an office to apply? I thought we could apply online for retirement. Yes, you can apply for retirement online. But this is another issue, is that they're pushing to retirement, and that's great. If the only thing available to you is retirement, and your earnings record and everything is correct, and you're doing it at the right time, you're not, getting, the annual earnings limit, and, you're not losing money because you're not waiting for, delayed retirement credits or your full retirement age or whatever. If 100% you're fully informed and you go ahead and file online, then beautiful, awesome, great. The problem is a lot of people aren't fully informed because there's exceptions, the exceptions, exceptions. Okay, you file for retirement benefits, and I get people here all the time, and they say, "I didn't know I could file for survivor benefits. I lost, tens of thousands of dollars over the last few years because I shouldn't have filed for retirements. I should have filed for surviving benefits first and let my own retirement benefits increase. Oh, I should have filed for spouse benefits too. I didn't know I could have filed for, ex-spouse benefits on this other person." So that's one of the problems with file on the internet is, you get what you get, but you don't know what you don't know, right? So I think I forget who was Donald Rumsfeld said that, right? You don't know what you don't know. Let's see. Just turned 65. If I take Social Security now, I would have to get a part-time job to make ends meet. If I take Social Security now, I'm thinking I'll not have enough money at FRA for retirement age and will need to keep working until I pass. Yeah, that's one of the difficult things. A lot of people out there are struggling, and so you can receive benefits at 65. Early as 62 for regular retirement spouse benefits, surviving spouse benefits. You can start at 60 years old. That's another thing. You know, People don't realize, they think surviving benefits start at 62 years old. No, you can get surviving spouse benefits at 60 years old. You've got way too many people that are losing money there. But in your case, you can start your Social Security benefits and you can work. Remember, you can work. That's another thing. Annual earnings limit first. There's just so many people that are missing money because you just don't have access to good help. But next year you can make $23,400. Anything over $23,400, Social Security holds back $1 for every $2 you go over. And remember, if you just turned 65, you also have to sign up for Medicare. If you don't have health insurance from current work, yours or your spouse's, and your employer has 20 or more employees, then you do not have to sign up for Part B, Part A, Part B, any of it. Once you stop working, so if you have health insurance from work, yours, your spouse's, 20 or more employees, then you don't have to sign up for Part B. Save yourself the $185. Sign up next year, 2 years from now, 5 years now, doesn't matter. You won't get penalized. But if it sounds like you're not really working or you have a part-time job, probably don't have health insurance from that part-time job, then you need to sign up for Medicare. So you have 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. So a 7-month period to sign up for Medicare and to avoid any penalties. There's a penalties for Part B and Part D, the prescription drug plan. And then once you sign up for Medicare Part A and Part B, you have to figure out what you're going to do to cover all the gaps. There's a bunch of gaps of original Part A and Part B. That's why people get a Medicare supplement plan or a Medicare Advantage plan. I always recommend Medicare supplement plans first. Please check out the Medicare supplement plans first. The plan N or plan G. And if it's just not right for you, then start talking about Medicare Advantage. And you can reach out to my partners at Chapter, and they help you 100% for free. They'll look at all the plans in your area. And yeah, just tell them Ed sent you and say, tell me about Medicare supplements in my state, and they'll help you out. Let's see. Congress wants all at home workers brought back into the office. No more work at home. Reasoning is they can help in the office along with the assigned work. No, it's another distraction. My office, during COVID and everything, um, Social Security employees can do just as much at home as they can. Actually, they were more efficient at home. So this is another distraction that politicians use. We'll give you all money, but you need to bring people back in the office. And that's just no. That's like the Revolutionary War, taxation without representation. We didn't want to be represented. We didn't. That was just anyway. Um, so here's how it happens. Here's how the offices work. Okay, you've got a claim specialist. Let's say a Title II claim specialist, and they have a retirement appointments for the day. So every office in the country, they have this system called VIPR, VIP, the visitor intake process, and then you assign this employee, Jane over here. You have 6 or 7 or 8 retirement appointments today to take. Here's your appointments. And if you're sitting right there in that desk, or if you're sitting 10 miles down the road, it has no relevance whatsoever. You still have 10 appointments for that day. If you're on the phones, I had 4 monitors in my office. I had one checking the line, I had one where I would work, and I had one checking the appointment schedule and the phones, so I could see exactly whether that person was right there next to me or 10 miles down the street. I could tell exactly how many people that person is helping, how much they're on the phones, how much they're taking breaks and stuff like that. It doesn't matter where they are. So it's not relevant. You can do just as much from home as you can, in the office with today's technology. So, yeah. But if you want people to come in the office, but don't use that as an excuse. Don't use it as an excuse not to fund Social Security. But that's what politicians are doing. So, yeah, it's again distraction. But we're smarter than that. I'm 61 with stage 4 cancer. Oh my gosh. And going to apply for SSDI. Will I qualify for an Advantage plan 2 years after I'm approved, since you previously said I can't get a supplement plan until I'm 65? Okay, number one is you should, in your particular place, you're going to apply. Please apply immediately. Immediately. Call the 800 number and schedule an appointment. And this is what's called a Terry case. So you'll be expedited, and they'll put a Terry flag on your disability case. It's a terminal illness type of issue. And if everything checks out, you provide the documentation. If you have any medical records that specifically say that, your case will be improved almost immediately. And then it depends on, in terms of a Medicare plan, it depends on your particular state. And most states, yeah, if you're under 65 years old, you can't really get a Medicare supplement plan, unfortunately. I wish it was different, but so yeah, in 2 years, but you can get a Medicare Advantage. There is no prior authorizations as of now. We'll see what Dr. Oz does. He's trying to make Medicare Advantage for all, and make that as a kind of the default option, a mandatory option or whatever. But prior authorizations definitely need to be addressed. The networks need to be addressed, and they better not bring back pre-existing conditions type stuff. Medicare supplements do have pre-existing conditions. That's why you can't get a Medicare supplement, because you have to go through health underwriting and stuff. So, but yeah, Medicare Advantage, you'll have, as of right now, you'll have no problem getting a Medicare Advantage. And then when you turn 65 years old, then you're in that window where it doesn't matter. No company can deny you a Medicare supplement plan at that time. So you can get an N or a G, no health underwriting whatsoever. But if you're under 65 in most states, yeah, you can't get one. So, all right. When are the actual dollars being cut for the fraud 67? Again, right now, 2034 or 2031. And why is there the few years earlier and more? Well, if they don't tax Social Security benefits, which you might agree that 40% of people don't pay Social Security taxes. The lower income people, they don't pay taxes on their Social Security benefits. That cutting taxes on Social Security is not going to help the people that really need help. It's the people that have other money that are going to get a tax break. It's fine. Okay, I don't think Social Security should have ever been taxed. The Social Security benefit should have ever been taxed. Okay, but that right now that brings billions of dollars into the Social Security Trust Fund, and if that's cut, then those billions of dollars, I think what $60 billion, need to be made up. And so if it's not, then we're going to get more cuts in the future, and it's going to happen sooner. And there's other things as well. So um, certain careers cannot be automated, as this entity needs humans to assist humans. I agree. Yes, there's again 20,000 pages of policy and stuff, and I use Chat GPT sometimes, and it's like, oh my gosh, wow, that's yeah. Um, so how does petitioning for more office support affect the dollars of each check? It doesn't affect the dollars of each check. It affects the people, the human beings that are trying to access the dollars. I don't see the petition. I'll pop it up in there again. Let's see. Let me go ahead and throw it up in the chat one more time. All right, excuse me while I do this. All righty, there it is. Okay, there it is one more time. All right, let's see. Jumping around a little bit here. All right. I worked 20 years, took care of my disabled husband, and daughters were of a lot because of a family medical leave. I became disabled neck and back, and I got Social Security $1,300 a month. Okay. Uh, Laziness has escalated in America over the last 40 years. Most of all, government employees have the lazy butt syndrome. It's yeah. Are there lazy employees at Social Security? Yes, obviously. Are there people that have a bad attitude? Yes. And so please, speaking as a district manager of an office, we had close to 100 employees. And if you get one of those, please report them and complain, because these are federal employees, and we can fire them. I've fired many federal employees, Social Security employees, and there's reasons to fire them. They're adjudicating claims incorrectly, or doing things incorrectly. They're accessing systems they shouldn't access. That's a immediate fire. That's immediate. As we used to say in the Marine Corps, big chicken dinner. Bad conduct discharge. But if someone is just rude and nasty, we have to have documentation of that. So I've had a few people that usually you have to have three of those, because some people people have bad days. They've got everybody's got personal issues, and the person before you might have been really nasty, so they kind of anyway. But it's just like baseball, three strikes you're out. So if I've had employees that has two strikes, and I'm like, yeah, this person is just a nasty person, I just need one more. So, and I was just waiting every day. Oh, please, someone complain about this. Somebody complain about this person. And a customer comes up and says, yeah, I'd like to complain about that person. I'm like, inside, I'm like, yay, good. And then we fire them. So yes, please, if you get someone like that, please let the people know so we can get those people out. But unfortunately, a lot of the district managers in the office is, because they can't get anybody to replace that person, sometimes they kind of turn a blind eye, and they said, yes, this person is a bit lazy, and they're kind of rude, and they're not very nice, and they have terrible bedside manner, and whatever the case may be. But at least they're accomplishing 80% of the work. They're, the other 20%, they could do a lot more, but that's 80%. And if we let this person go, that's going to make it difficult for everybody else, and we're not going to be able to provide the customer service, because because we can't replace that person, because we don't have the allocation to replace that person. So unfortunately, that's one of the reasons that bad employees are kept around, because it's something is better than nothing. Yeah, it's a sad situation. So I was shocked at how Social Security employees were dressed when I went in person. Rude and dressed like they're going to a Metallica concert. Yeah, there is no. Yeah, I agree. There are limitations. We used to have this one employee that we've fired her. But yeah, she used to come in, and if it's not, suggestive and, political or anything like that, then yeah, Social Security really can't do anything. Unfortunately, I think they, yeah, should have a little bit more of a dress code, but what are you going to do? See how long it takes to get your driver's license renewed to the Department of Offices. Yeah, Department of Transportation is ridiculously slow. They just do not care. Yeah. They want to charge me $905 deductible. I have a Champ VA insurance through my deceased husband who is 100% disabled. 100 Champ VA. Yeah, Champ VA. That, yeah, not sure deductible. Um, yeah, I'm not great on veterans, Champ VA, TRICARE, and stuff like that, but I haven't heard of really a deductible on that. But I'm not 100% sure. Even though I'm a veteran, I only spent 8 years in the Marine Corps, which is 20 years in all other services. But anyway, so I don't have VA medical or anything like that, so I'm not that too familiar. I'm looking for, if y'all know anybody that wants to join the program. You got anybody that's a veteran expert, any type of experts that you know about that want to join, and we do a little interview, please tell them to reach out to me. And yeah, and we'll bring more people on here to help you all out. Couldn't write the survey keyboard when it come up on the. Oh, okay, well, all right. What will happen to Section 8 on disability renewed the lease? I will receive, yeah, Section 8 housing, welfare type benefits like that, Medicaid, TANF, temporary assistance to needy families, Section 8 housing. That's usually on the chopping block first. Yes, unfortunately. Can you change plans after enrollment or need to wait until next year? Current supplement plan G have A, B, and drug D starts January 1st. Rephrase, no names. Mercy. Okay, yes. Yeah, I try to avoid company names. Um, and so it really, yeah, so you've got a Medicare supplement. So the Medicare supplement plan, you can change that 365 days of the year. So if you have a G from one company, you want to find a cheaper G at another company because, a G is a G is a G, an N's an N's an N. So if you just want to save some money by going to a different company, you can do that all year long. It depends on your state. You might have to go through health underwriting. The Part D, a little bit more difficult. You probably won't be able to do that till January 1st, and it'll take effect February. But you can at least talk to somebody right now. So talk to your, agent or broker, or reach out to Chapter, and they can tell you exactly what you can change and when you can change it, and see if there's anything better to change it to in your particular neck of the woods. I'm on SSA disability. How much money can I make working a job? Check out my video I did on working on Social Security. It looks like that: Social Security, disability, and working. You have a trial work period, so the first 9 months you can make as much as you want and collect Social Security disability. After that 9 month period, then anything over substantial gainful activity, which next year is $1,620. Anything over that, Social Security holds back $1 for every $2 you go over. Um, and well, actually, no, I'm sorry. That's for retirement. For disability, anything over that, they can stop your check for that particular month. So, all right. Let's see what else here. Why do I have to pay taxes on my SSDI? Yeah, everybody, survivor benefits, spouse benefits, SSDI, retirement. If you're making over the threshold, what is $25,000, and the interesting thing is that threshold hasn't changed forever. So yeah, I agree. There's you know, they my old drill instructor, if I wanted your opinion, I'd give it to you, right? Or I'd beat it out of you. I personally don't believe Social Security benefits should be taxed. It should have never been taxed, but it has been, and it's billions of dollars coming in and helping out the trust fund to make sure we get benefits in the future. So if we stop it, we just have to find money other places. And everybody here that's a regular viewer knows how I would solve Social Security. And it takes about 10 minutes to figure out how to fix the Social Security problems, but it takes the political will. Um, increase letter arrived today from supplement stating premium increase in January. Have advantage in January. Can these plans notify people after open enrollment? Yes, the supplement plans. That's a bad way to do it. I agree. So when the The annual enrollment period for Medicare Advantage and Part D and all that kind of stuff, that's from October 15th to December 7th. So that's over. We've got another enrollment period coming up here in January, and I'm going to have someone from chapter go through all that. So probably next week, he'll come in and he'll go through all the details of what you can do. But unfortunately, yeah, the supplement plans don't tell you about the increase until after the enrollment season. So yeah, it's kind of they should really tell you before, don't you think? And that way you can decide whether you have a budget to keep a supplement. But yeah, you reach out to chapter, whoever your agent or broker, and see if you have anything, any other options. Um, but yes, yeah, Thutch 052 supplements do annual rate increase. I strongly recommend keeping supplements for access to care mostly. Yes, please. As long as you're able to keep a Medicare supplement plan, please keep it. Please keep it. But someday, people have said, well, I just can't afford the monthly premium anymore. And that zero premium, that zero Medicare Advantage sure looks enticing. Yeah, until you get sick and you have to actually go to the hospital and then you pay this and that. And you've got this max out of pocket. And then you've got the denials and the delays and the vanishing networks. And so please keep your supplement as long as humanly possible. So. I have SSI, yes, SSI, and trying to buy a car. I'm not allowed to have two cars. Is there a grace period? I need my car to look for a car. Yeah, um, that's a good one. Yeah, you can only have you can only have one car. One car is exempt. But yeah, if you get rid of it the same month, so yeah, you get your car, and maybe do a trade in or something like that, and that way you've only got one car under your name, or yeah, I would reach out to the again, this is another thing, reaching out to the Social Security is almost impossible. And, tell them, hey, I'm going to have a car and I'm going to buy another car. So I might have two cars for a week. And they should kind of understand that situation and not to ding you for that particular month. So my brother draws Social Security benefits and makes less than I do, but his wife makes $50,000 a year, so he has to pay taxes. I draw only 18,000 a year and pay no taxes drawing Social Security. Yep, that sounds right. Yep. Let's not forget that Congress that went with each of those presidents. Yes, yes, yes. Yeah, let's not let any of these guys off the hook. They are all responsible. You've got one, political party that, has tried to destroy Social Security since 1935 that never wanted it, and so they've always had the same goal is to get rid of Social Security. And then you've got another part that wants to keep it, but I don't know, incompetence or not, or they're giving into their political their financial overlords, or whatever the case may be. So I'm not forgetting any of them. They're all you know if they were able to do it, again, the solution, I've got the solution in the description. Social Security actuary, the guy that runs all the numbers, anytime anybody comes up with a proposal, here's how I would save Social Security, and any politician, here's how I would do it. They'd submit it to him, and he runs the numbers. And it says, oh, well, yeah, if Social Security does your plan, that's going to solve 6% of the problem. What about this plan? Well, it's going to solve 13% of the problem. And that little spreadsheet is in the description under the actuary. There's one that will solve 73% of the problem, and that's the one I advocate. And then we just need to add up another 10 or 20% from other places to solve 100% of the problem. So, it takes 10 minutes to run those numbers and figure out what we need to do. So easy. It's just that we need, the political will to pass it through the House and pass it through the Senate and get the president to sign for it. But, you know, it hasn't happened. So I'm so discombobulated about expensive insurance until I may not get it for 2025, but no, there's ramifications behind that decision too. Oy vey, mamma mia. Yes. Yeah, the whole thing is way, way, way too confusing. I agree. And, that's why reached out to Chapter, because they look at all the plans and they're really, patient during the last week of the annual enrollment period. Very difficult to get a hold of, but yeah, they're available now. But if I had my way, then sorry, chapter and Medicare insurance companies, but y'all would be out of business. You need to go find something else to do, because what should really happen is all the gaps of Part A and Part B of Medicare should just be kept filled. That's it. Easy. Done. Won't need private insurance. Won't need these companies. Um, and they need to add dental, vision, and hearing to original, Part A and Part B, and that's it. So it's super, super easy to fix. But yeah, there's too much money in private health insurance, so that's not going to happen anytime in the future. So my husband is, and so until it does, we just have to make the best of the possible system. And again, check out Medicare supplements first, and then check out Medicare Advantage after that. My husband is 61. I am 63, collecting my SSI. His SSI is the welfare-based program. You probably just mean regular retirement benefits. So his Social Security is more than mine at his age of 62. Can I reapply for his total now? His has to be twice as much as yours, not the check amount, not what you actually receive, direct deposit, not that amount. It's the primary insurance amount. It's the amount you would receive and he would have received if you waited till your full retirement age. That's the number Social Security looks at to determine whether one gets benefits off another person, the spouse benefits. How do you know that? You just call Social Security again, try to get through. Call Social Security, and you and your husband sit there on the phone and wait the 3 hours, and hopefully somebody picks up. And you say, "Hey, can I get any money off this guy?" Or vice versa. And they'll look at your PIA for both of you. And yeah, if you can get more money, they'll set you up an appointment for 2 months or 3 months, or yeah. So try that. Call one of the fancy restaurants in your town and see if you can get an appointment within the next few weeks. And then call Social Security and see if you can get an appointment. Hey, that's just, oh my gosh, that's just crazy. Um, can supplement plans notify us of premium increase after open enrollment period? Yes. Yeah, unfortunately. Plan increases twice a year. Chapter got me an Advantage plan in January. Yeah, it sounds like you just couldn't swing the supplement plan anymore. So yeah, that's unfortunate. I wish if everybody got a supplement plan, then the supplement plans would be what, 20% of what they are now, and then it'd be affordable for a lot more people. But all right, since you essentially, it sounds like you were, because of a budget issue, just you had to get a Medicare Advantage. All right, so now that you get a Medicare Advantage, it's not the best system, but there is a way to make sure. So the number one thing is you check it every year. If in January, February, March, you can change it. So if and you have that plan and you've got it in January, and then February comes along and it's just not working for you, then reach out to chapter and stuff, and they might find you a another Medicare Advantage. There is no, it really depends on your particular situation. It might find you another Medicare Advantage plan, or you might be able to, because you had a Medicare supplement, and then it depends on your state. You're trying the Medicare Advantage, so sometimes you have within a year to go back to the Medicare supplement plan. It depends on whether you ever had a Medicare Advantage, and all kinds of different, there's all kinds of different loopholes. So yeah, January, February, and March, just kind of play around with that Medicare Advantage plan, and if you like it, then keep it. Just keep an eye on them. And Chapter has, the reason I chose them is they have it's called a member success team. So if you have any issues with prior authorizations and doctors and medications and stuff like that, make sure you reach out to them and they can help you out. So, but yeah, just keep an eye on it. And if you want to switch back, you maybe give them a call. Maybe give Chapter a call and say, okay, my Medicare, if they haven't already told you, say, okay, I'm signing up for a Medicare Advantage plan. It's going to start in January. I'm going to try it for a few months, and then ask them whether you have what's called the guarantee right, a trial right to switch back to a supplement plan. And you might be able to do it within 12 months, depending on your particular situation. So if nothing else, that. So, and if nothing else, you get to save, your Medicare supplement premium for 12 months. And maybe that will, be enough to get you back into it later. So again, particularly on your particular situation. So I will be filing for survivor benefits when I reach full retirement age next July. How do I make sure they know what to wait on my retirement benefits until I retire in a couple of years? Built up DRCs until 68 and a half. Okay, perfect. Yeah. So you just go in there and you're going to restrict your application to just survivor benefits and you did not take retirement benefits on your own record, you haven't touched your own record, you're going to take survivor benefits, and they'll just take a claim for survivor benefits, and you just remind them, in case it's a new person, that says, okay, I'm not touching my own. I'm going to let my own increase the delayed retirement credits, and I'm going to jump back on my own at 68 and a half or 69, or make sure you don't do it after the month you reach 70. Too many people are, I'm 73 years old. When should I start retirement benefits? 3 years ago. So yeah. Let's see. Is this video being saved so we can watch Ed's comments later? I have to get on the road. Yep, absolutely. Every time I do a live Q&A or a live, um, it always goes up immediately to the regular recording. So if you go into my channel, it's under the live section, and absolutely. Yep. Medicare Advantage plans do not rate increase during the plan year. Correct. Yes, Medicare Advantage. Yeah, most of those are zero premium, but you know it's zero premium, but then there's the ongoing costs and stuff like that. So yeah, but those plans are good for 1 year. So people, tell me all the time. They say, I've had my Medicare Advantage plan for 3 years. No, you haven't. You've had maybe that company and maybe that card, but those plans are only good for 1 year. They expire December 31st, like Cinderella, and then a new one takes effect January 1st. If it's kind of like the previous one, it's the same, code to number of the plan, same company, then it just automatically renews. But a lot of the stuff under the hood could very well change. And yeah, so last year you were, if you went to the hospital, you had to pay $100 a month or $100 a day, and next year you might have to pay $500 a day. You might pay that much for your prescriptions last year, but next year you might pay this. And yeah, unfortunately, there's going to be a lot of people for sticker shock. All right. Let me see if we're running out of time here. Let me jump around and see if I can find anybody that I haven't seen here before. We can answer some questions. How much money can I make working a job while being on SSDI before retirement? I'm 52 and I'm not sure what to do and not sure the age to retire. So if you're on disability, you're going to be on disability. Then you don't do anything. You don't, file for retirement benefits. You just stay on You just stay on disability. Your disability automatically switches to regular retirement at your full retirement age, 67 years old, unless they, change it. But yeah, watch my video I did on working and receiving Social Security. Again, you have the trial work period, then you have the extended period of eligibility. So Social Security tries as much as they can to, facilitate you returning to work because you make more money and saves the Social Security Disability Trust Fund and all that kind of good stuff. So you can also call Social Security has an organization they contract with. It's called Ticket to Work, and you can reach out to them and they can kind of work you through some of the options and help you out and stuff. So definitely taking advantage of that because you paid for it. My dad is a widower. His wife died 11 years ago, and I called the Social Security about. Okay, let's see. All right, don't see the other part of that question. My brother is 61 and receiving total disability benefits, living in Arizona. Does he need to move back to California to be able to receive Social Security? No, Social Security is a national program, so yep, doesn't matter where he lives. As long as he doesn't move to North Korea or Cuba, he is good. I'm a Medicare broker. Okay. I have a client who has been trying to get his wife on his benefits. She's from Colombia. They've been into the Social Security office locally, provided all documentation, and still nothing. Yeah, that's probably might be going through, get a confirmation from the INS or something like that. Customs, immigration to see if anybody that is not a U.S. citizen that has a green card, the green card usually has to pass through a system to confirm that the person is in the country legally and can't get benefits if they're not. Then, yeah, it takes a little bit longer. But um, if they've been waiting for a while, so that usually, it should only take, a week or two to get that back. But if it's taken, again, in the old days, now is totally different. But if it's been over a month or two, I would reach out to your politician and go onto their website and click on the little button that says "I need help with a federal agency," and tell them what's going on, and they should be able to help you out. I called to make and that's a good broker right there. So he is looks like he's a Medicare broker, and he is helping other people do all kinds of other stuff, and that's awesome. So there's a lot of independent Medicare insurance brokers out there that do an awesome job, and so yes, thank you. I called to make an appointment to start collecting my Social Security. I will be 62 in March. I was told there's one appointment available, basically to take it or or yeah, that's that's unfortunate. But yeah, you definitely called ahead of time, so you should be able to get in there. If you're 62 in March, if you were born, first, on the second, your benefits will start in April. But if you were born, other than the first or the second, then your benefits won't start until April because you have to be 62 the entire month. So. All right. Unfortunately, we are out of time and we've got so many questions. Let's see. Let me jump through here and see if I can get one. I've been on New Jersey Medicaid insurance for the last 5 years. I turned 65 next May. Does Medicaid auto enroll me into a Medicare when I turn 65 next year? Do I qualify for both? Do I need a supplement? Okay, all good questions. Okay. Um, if you're receiving Social Security benefits, retirement, spouse, survivor benefits, then Medicare will sign you up automatically about 3 months before you turn 65, so you don't do anything. But if you're not receiving Social Security benefits, then you have to sign up yourself. And if you're insured, that is, if you're insured, even if you're not, you have to sign up. But when that happens, make sure you reach out to Medicaid and tell them to pay for your Part B premium. And depending on what level and what state you're in, they just might pay for that Part B premium, the $185. And then if you have Medicare and Medicaid, which yes, you can have both, then you can possibly, depending on your state, what level of Medicaid, you can get what's called a Medicare Advantage dual eligible plan. So if you're on Medicaid, I do not recommend a Medicare supplement because essentially you can't get one, but you can get a Medicare Advantage plan. And if you're the higher level of Medicaid, get a Medicare Advantage dual eligible plan. Dual because you're eligible for Medicare and Medicaid, and those are the ones that usually have a lot more bells and whistles and benefits, depending on your neck of the woods. All right, that is it for today. I apologize, not able to get to all the questions I can. I will be back again tomorrow.